In this video, we will explain the safety of oral and transdermal ingestion of LPS. LPS is a component of gram-negative bacteria. The middle photo shows the bacterial colonies seen through an electron microscope. The cell wall of one of these bacteria, when enlarged, has a lipid bilayer membrane, and LPS is embedded in the outermost layer. The LPS binds to a receptor, called TLR4, of the cell, and activates the cell. Please watch LPS Learning 1 for more detailed explanation of LPS. Gram-negative bacteria live in soil. They also coexist with plants that grow in soil, and are indigenous bacteria in our intestines and skin. Therefore, LPS derived from gram-negative bacteria also exists in plants and in our intestines and skin. Gram-negative bacteria are also used to ferment certain food ingredients, such as xanthan gum and vinegar. Therefore, LPS is included in food and seasonings we put in our mouth. As such, LPS exits in the environment and outside and inside the body, as well as enters the mouth with food. Does it cause any disease? In fact, no. Live bacteria may cause opportunistic infection in some cases, but LPS, a bacterial component, does not cause illness by entering the mouth or touching the skin. When we search LPS on the internet, we find explanations such as endotoxin and inflammatory substance. Why? Here is the explanation of the background. LPS was recognized in 1892 for the research on Vibrio cholerae. Vibrio cholerae secretes a toxin, called cholera toxin. Since it is secreted out of bacteria, it is classified as an exotoxin, by adding exo, which means outside. When cholera toxin acts on cells, the cellular functions are disrupted, and water and sodium are pumped outside. Therefore, when Vibrio cholerae infects intestinal cells, cellular water flows into the intestinal tract, causing diarrhea. This cholera toxin is a cytotoxic substance unique to cholera. Meanwhile, LPS is a substance in the outer membrane of Vibrio cholerae that is released from the outer membrane after the death of Vibrio cholerae and stimulates immune cells. Since it exists in bacteria, it is called endotoxin by adding endo, meaning inside. However, LPS is actually a substance that cannot be called a toxin. LPS does not have cytotoxicity. It is correct to say that it only activates the functions that cells originally have. When the cells that it acts on are immune cells in the body, it makes them produce inflammatory cytokines. In the case of infection with Vibrio cholerae, it is an essential reaction for us to produce inflammatory cytokines to eliminate it. LPS is not specific to Vibrio cholerae, but is a common substance that gram-negative bacteria have. As you can see, cholera toxin and endotoxin cannot be grouped into the same category, even though they both end with toxin. Now, we will explain why LPS cannot be called an inflammatory inducer. Cholera toxin, enterotoxin, and diphtheria toxin have cytotoxicity. They disrupt cell function and kill cells. However, LPS, which has been called endotoxin, does not kill cells, but enhances the cellular function that cells have. For example, if the cells it acts on are immune cells in blood vessels and organs, it induces inflammatory cytokines. Treg cells that suppress inflammation, however, it increases the anti-inflammatory effect. Gastrointestinal tract cells, it increases the production of antimicrobial substances, or enhances the ability of foreign body phagocytosis. Skin cells, it increases the barrier function, and accelerates the proliferation of skin cells. The action of LPS depends on the type and location of cells. If LPS is directly carried deeply into the body, by infection with pathogenic bacteria or injection, it may cause inflammation. However, when LPS is taken by mouth or applied to skin, it is not toxic at all. The reason why LPS was said to be an inflammatory substance was that it was only known for the role that attracted attention at the time of infection with Vibrio cholerae. But now you are trying to learn about the new aspect of LPS. What you should remember about LPS is that it is not a substance absorbed in the body. LPS is not absorbed in the body when taken orally. LPS taken orally activates cells in the mucous membranes, such as the oral cavity and intestines. In those cells, it increases the production of antimicrobial substances and enhances their ability to eliminate foreign substances. However, cells stimulated by LPS in the mucosa also secrete liquid factors and/or migrate, which have an activating effect throughout the body. In this way, LPS can activate systemic innate immunity without being absorbed. Now you know that LPS is safe in oral and transdermal use. But how about in special situations? Wounds on the skin or oral cavity, leaky gut, periodontal disease, autoimmune disease, for example. First, in case of a wound, LPS is not alive, so it does not increase or move actively. Therefore, it does not move by itself to reach the inside of blood vessels. In addition, when LPS enters the body, it is inactivated by factors that bind to lipids. LPS is carried into the body with activity in a state where it is embedded in the outer membrane of living bacteria, or when it is artificially injected. Now, what about leaky gut? Leaky gut is a state where there is a gap between the cells of the intestinal wall. In the leaky gut, live intestinal bacteria enter the body through gaps between cells. At that time, LPS that exists in the outer membrane of bacteria is also carried into the body. This is very likely to lead to inflammation. However, the problem is that live bacteria are brought into the body. Free LPS taken orally is not dangerous. For periodontal disease, since periodontal disease bacteria are gram-negative bacteria, it is sometimes said that LPS in periodontal disease bacteria may be the cause of inflammation. In fact, the structure of LPS of periodontal disease bacteria is unique, and there is almost no inflammation-inducing activity. Therefore, it can be said that the progression of periodontal disease is due to the activity of live periodontal disease bacteria, and not due to the LPS. Autoimmune diseases are diseases in which antibodies are produced against patients themselves, which are not usually produced, attacking themselves. Steroids and immunosuppressants may be used for the treatment. In such a situation, you may not be sure whether or not to take LPS that activates immunity. However, autoimmune diseases are mainly caused by abnormalities of acquired immunity that produce antibodies. Innate immunity activated by oral intake of LPS has an action to modulate acquired immunity, and there is no risk of worsening autoimmune disease. For these reasons, even if you have any diseases, we can say that oral and transdermal ingestion of LPS in a natural situation is not associated with a risk of worsening them. The safety of LPS has been explained. Now, what will happen if LPS is deficient? What we have experienced in our history is that changes in our living environment and diet may lead to diseases of unknown cause. For example, in the Age of Discovery in Europe, a disease called scurvy was born. This is due to a deficiency of vitamin C derived from vegetables and fruits, due to a long voyage. In Japan, a disease, called beriberi, was born in late Edo period. It resulted from a deficiency of vitamin B1 that had been taken from rice bran, which was caused by a shift from brown rice diet to white rice diet. At that time, people didn't know the presence of substances called vitamins, so it took a long time to detect the cause. Conversely, a disease was born, and we looked at its causes, and came to know the essential components of vitamins. In contrast, allergic diseases have increased in recent years. As a result of cause investigation, it became clear that it was caused by a reduction in natural intake of bacterial components, particularly LPS, in the sanitary environment. In this regard, recognition of the usefulness of LPS is similar to discovery of vitamins. For those reasons, we call LPS an immune vitamin. We will explain a little about the term immune vitamin. The definition of vitamins include the following three: nutrients essential for the survival and growth of living organisms, and deficiency of them causes disease and growth disorders. They cannot be synthesized in the body, so they must be taken in from the outside. Organic compounds other than carbohydrates, proteins, and lipids. Strictly speaking, LPS is not a substance that is classified as a vitamin. However, LPS almost fits the definition of vitamins. As mentioned earlier, LPS is similar in that its usefulness began to be recognized in a similar process to the discovery of vitamins. For us, LPS is something like a vitamin that works on immunity. It is essential for immunity, like vitamins. The term immune vitamin is coined words that include all of these implications representing the image of LPS. Finally, we will present the safety test results of LPS for healthcare. The safety study of LPS for food use was conducted according to the global standard, and the safety at doses up to 4,500 times the recommended dose has been confirmed. A typical LPS food material has cleared a very strict safety review in the United States and has been approved as a GRAS substance for food use and an NDI substance for supplement. A repeated patch test in humans confirmed LPS for cosmetics caused no adverse events. The table in the upper right shows the results of the repeated patch test of a raw material of LPS for representative cosmetics. These are the results at concentrations 10 times the recommended dose, but they are comparable to those of the water patch test, shown in the lower right table. Thank you for watching to the end of this video about the safety of oral and transdermal ingestion of LPS. We hope this video will lead to your understanding of LPS.